Good day. My name is Imelda Williams. With this presentation, I'm going to give you feedback about Formative Exam 2, which covers the radiographic appearances. That exam is a mirror of what you can expect in the final exam for radiographic appearances, which will be undertaken on the 2nd of November. I will also provide some information regarding that exam as well. So this feedback is just general feedback. So Formative Exam 2 has got two parts to it. Firstly, it consists of multiple choice questions, so short answer questions and matching questions. And I think there's one true or false question. And the marks for that is 15. Part B includes 10 case-based scenarios. Each has images attached to it, and each case is worth 3 marks. So it's really important with those cases that you do include enough information for 3 marks. I've also made available image manipulation software, which can be used with Part B, and I would encourage you to use the image manipulation software. The link to the image manipulation software will also be available in the final exam. Because there's 10 cases included, the total marks for Part B is 30 marks. So for Part A, once you complete the formative exam, you should be able to see the results for Part A. Because those marks, I've set it so that you will get feedback after the exam. The matching questions often is related to the radiographic anatomy. So I would like to encourage you to go through the PowerPoint presentations with the images and the labels and identify those labels. Similar with the matching, with the multiple choice questions as well. The short answer questions, normally you should not write more than 10 words in the short answer questions. And that one I will normally also go in and manually mark to ensure that your answer is, the correct mark is attributed as well. So what I'm going to do now is just to go through one of the scenario-based questions, because Part A is fairly simple, and just to go through the way that should be marked. I'll just stop share now and then reshare. Okay, so I've opened up the second case, which is the scenario of a pediatric patient. And this is a forearm. And I'm just going to zoom in for this view. Okay, so it's important when you look at this image that you can see there's fractures of the proximal ulna. However, there's multiple loosened lines, which means that this is a comminuted fracture, and that is important to include in your answer, that there are comminuted fractures of the proximal ulna. Now, it's always important when fracture is near the joint to check whether the alignment is intact. So the first thing we're going to look at is the anterior humeral line. So this is the capitellum, and we can see that the anterior humeral line completely misses the capitellum. And then if we draw the radiocapitellar line, which is from the proximal part of the radius, and it should be able to meet the capitellum in the middle third, and you can once again see it does not meet the radiocapitellar line, is not aligned at all. We can also check the radiocapitellar line on this view, on the second view. So if we again draw that line, so that's the ulna, this is the radius, and if we draw the line now, we can see that it totally misses the capitellum. So what we have here with this case, we have got comminuted fractures of the proximal ulna. We have a dislocated radial head, and that is of course in keeping with a Montague fracture. So that is the way that you should approach the case. However, if this would have been a normal case, and of course in the exam I could put in a normal case, so it's important then to look at the case and the clinical indication. So if it's clinical indication for trauma, you should think what is really important to mention. So first thing with trauma is you want to exclude a fracture. So if it is a normal trauma case, you would definitely mention about the bones. You would mention that there are no fractures. It's important to exclude any dislocations, and that's the next thing that you would want to mention, that the joints are intact and there's no evidence of dislocations. You could mention, for example, about soft tissue signs, that there's no soft tissue signs that would indicate that there's a fracture. For example, if you have a knee x-ray, there's no signs of, for example, lipohemarthrosis. And of course, you should then conclude that this is a normal case. So even in a normal study, it's important that you do mention at least 3 facts about that case, so that you can be given the 3 marks. So don't just write normal study, because that will only give you 1 mark. Remember that all of the cases are out of 3. The scenario-based cases are marked out of 3. So for the formative test, it's important that you complete the formative test. So this has just been general feedback. Once you have completed the formative test, please email me and I will go in and I will manually mark your test, because it cannot be marked automatically. And then I will give you specific feedback on each of your answers, especially with the case-based scenario questions. So it's important that you do the formative test. You can do the formative test anytime until at least before the exam, so that you know what kind of questions can be expected. So the formative test is out of 45. There were 10 questions, a case-based scenario, which made it 30, and then 15 of the part A questions, which included multiple choice questions, short answer questions, as well as matching questions. So that's now all about the formative test. Now, this week concludes the materials for the radiographic appearances. As from next week, you will be undertaking the CT part of this unit, and that will be delivered by Crystal. Now, for the summative exam, so the final exam, which will take place on the 2nd of November, because of the fact that the exam will use the image manipulation software, I will not be able to use responders. But what I will do before the exam is to email you and let you know that there is a privacy statement that you need to accept, and that needs to be accepted at least a day before the exam. And in that statement, you will need to agree that you will not plagiarize or collude during the exam. And that is simply because we can't use a safety browser which allows you not to use anything else. So, so we'll not be using responders for the radiographic exam on the 2nd of November. Now, in the handbook, you will note that the exam is 90 minutes long. However, I'll be adding an extra 10 minutes, and that is to include reading time, so it will make the exam out of 100 minutes. I'll set the exam at 80 marks. The reason for that is because it should allow you enough time to use the image manipulation software so that you can scrutinize the images as well. In the exam, I will include 20 case-based scenario cases, and it will cover the upper limb, the lower limb, cervical spine, and of course the chest, which means that for that 20 cases, that will make up 60 marks. And then for part A, so there will be a part A and part B again. So part B will be the scenario-based cases, and part A will be the short answer or matching or multiple choice or true and false type questions. That will be out of 20 marks. For that section, as I mentioned, important to go over the radiographic anatomy to be able to identify that on the different images, and also go over the PowerPoint presentations, especially that has been made available during the weeks. And the materials will be from week 1 and part 2. So the psychophysics is excluded, that's not included in the exam. And then from weeks 2 to 8. So go over that material. So in total, the exam will be out of 80 marks. You'll have 100 minutes to complete the exam. And the exam again will be available from 8 in the morning until 8 in the evening. If you have any questions about the formative exam or the upcoming summative exam in November, please feel free to contact me. And if you have any questions whatsoever, please also feel free to contact me.